Dr. Prateek Nishant did his MBBS with honors and gold medal from Patna Medical College and MD ophthalmology from AIMS Rishikesh. He is qualified for DNB, has qualified for DNB examination also, and is currently working as a senior resident in AIMS Patna. His interest includes dash, food, etc., photography. So over to you.
Thank you, esteemed chair and my dear friends. Thank you for the opportunity to put forth my views on a topic that is very close to my heart, balancing your aspirations as a clinician, surgeon, researcher, and innovator. What are the aspirations of this generation, the Gen Y and the Gen Z that we are dealing with? It is, say, work-life balance, quality of life, climbing the ladder, your clinics and your surgery, research and innovations, and entrepreneurship, financial stability, creativity in everyday tasks, and the list goes on. And the budding postgraduate resident or the early career ophthalmologist is perplexed with the question of how to move ahead. Of course, we have been told by our senior teachers that there is no elevator to success, you have to take the stairs. What we haven't been made to realize is that the first step must be taken in faith. And you don't have to see the whole staircase, just take the first step. That said, it is time for introspection. Can I call myself a terrific surgeon when I do sometimes create complications I myself cannot manage? Am I an astute clinician when I occasionally miss findings which are most critical for outcome? Can I be considered a prolific researcher when I have fewer than 10 publications in index peer-reviewed journals with high impact factor? Could I ever be a great innovator when I have no dream patents or textbook methods in my name? What I realized early in my postgraduate residency is that deficiencies or mistakes have the power to turn you into something better than you were before. And well, the journey has already begun. In post-graduation, we long for surgeries, leave alone surgical competence. Let me tell you, my friends, that there is no dearth of learning resources. We have to aspire to learn every aspect, including, say, the drum organization or the trolley setting or the OT sterilization. We have to learn from online videos, machine demonstrations, say in conferences or when someone comes to demo a new machine in your department, and simulations. You have to identify your mentors to encourage you, help you navigate and avoid pitfalls. You should never hesitate to scrub in with your seniors to assist and look through the side scope. Assist as you would like to be assisted. Try out methods under supervision to see what works in your hands. And most importantly, learn from complications others create and manage. I'd like to highlight what tools I have used in my career till now and what I intend to continue using for the benefit of the postgraduates here. One of them is YouTube, and these are my favorite YouTubers, our prolific professors and teachers who have been teaching us remotely. One of them, Dr. Nato Rosatelli, who is a prolific surgeon, uploads his videos in 3D, and that can be viewed on a 3D VR headset. So that is something I would like to convey. And of course, the champion cataractcoach.com, Dr. Uday Devgan. Online surgical resources also include those available through the American Academy of Ophthalmology One Network and the iTube, which is kind of the YouTube of ophthalmology. The dry labs and the wet labs are important learning tools for every postgraduate. This is a Kitaro kit, no financial interest, which is available for the learning of postgraduates in dry labs. You also have the model eye on which the demo phacoemulsification can be practiced. And these and several other methods are mentioned in this publication, which can be viewed by everyone. And especially this is not for individuals, but institutions to take it up and establish facilities for the postgraduates or the residents to move ahead. You also have some simulators or apps. The Help Me See simulator, which is currently available for the small incision cataract surgery. The people have a stall on the top floor, which our postgraduates can visit. The IC simulator, which is there for phacoemulsification and VR surgery. This is there in the AIMS New Delhi. And any postgraduate can use this simulation also. You also have some innovative apps on the iPhone and iPad that you can do to get an idea how the capsular axis behaves. And these kinds of things are free. They're accessible to everyone. And these are things that you can use in your journey. In your journey towards clinical competence, try to treat all patients with the same care you'd give to your family or expect yourself. Build up a reservoir of trust so that your patients feel comfortable with you. Stay abreast of current technology and evidence-based patient care. Be strategic with time. Communicate effectively. Continue self-monitoring and self-evaluation. Diversify your skill sets steadily. Work up, investigate, manage, or appropriately refer, but don't forget to follow up. For the clinical skills, you also have YouTube resources, Morancore, iFocus, Best of LVPI Grand Rounds, Eklavya, Shankar Netrale. These are from standard institutions that not everyone has the privilege to attend, but they can always view these videos. You also have the University of Iowa Healthcare website, and of course, your clinical books. Improving in research, the 4P, which stands for podium power and peer-reviewed publications. Define the proportion of time to be allotted to each research. Honesty is paramount. Be realistic. Researchers are organized and enthusiastic about their career. Work closely, respecting your colleagues, fellow residents, and students. And seek some amount of support from your institution regarding productivity, your biostatistician, and to allow some productive research time. You can improve in research by staying committed to whatever new project and stick to the Gantt chart, because this every new publication is a long process. Well-written reviews and book chapters go a long way in increasing your credibility as a researcher. You may eventually be considered to be a reviewer for major journals, and subsequently you may get journal awards, citations, and recognitions among your peers. What I recommend for all residents is to sign up to this website, which is known as ResearchGate. This is my profile on ResearchGate. And you are free to follow all the prolific professors and the researchers in India and abroad, that you can look at their qualifications and their metrics and stay inspired. About gaining the innovator spark, it is not always expected of an early career ophthalmologist, but hey, why not? Active involvement with one's national organizations, attending surgical meetings, and interactions with your peers often provides you interesting clues. You can seek answers to questions commonly encountered in your OPD, OT field, and the community. You can get ideas to do things differently and also to do different things. You seek opportunities to submit original innovations in national and international platforms. You have to know about the rules and methods for intellectual property rights. So this is an example of how to do things differently. This is a paper which came up in our paper in this month's issue of IGO. We have used a specular microscope to look at the meibomian gland configuration of the patients presenting with primary meibomian gland disease. This is one example of how we do different things. This is my postgraduate thesis, where I devised an innovative method to measure change in ocular cycloposition with strabismus surgery using a DSLR camera. So this was presented in AIOC2022 and World Society of Pediatric Ophthalmology and Strabismus conferences. Friends, your career is a balancing act. It requires some more introspection and self-awareness. You have to make deliberate decisions, realize the power to change course at any time. And achieving this balance also requires choosing the right career path with focus on what is important to us at any given time. To strike the correct balance, plan each morning, reflect on the gains each evening. If your goals are SMART, then it's perfect. If not, do make a short-term and a long-term to-do list in your mobile phone. Take frequent opportunities to assess progress, as well as developing smaller, more achievable interim goals. Honest self-assessment of weaknesses and areas that require remedial, and make a genuine effort to correct deficits where possible, and if not, redirect effort towards the area of strength. Keep in mind this matrix and work hard on self-improvement every day. Friends, do not burn out. Ophthalmologists fare relatively well in surveys of physician burnout, but hey, the figure is 43.4%.
Prateek, last minute, please.
Yeah.
Prioritize. Sharpen your skills with the resources available to you. Make a reward system. Make a support system. In conclusion, there are 3 words that I want to convey: your ability, your motivation, and your attitude, which comes through well thought out goals, reliable support structure, realistic and clear expectations, and frequent re-evaluation.
Thank you, Dr. Prateek. Since we have no more time for discussion, we'll just request.
Dr. Nagendra wanted to say something, and before that, all the chairperson and speaker will stand up here to take a group photograph. Yeah. Dr. Nagendra,
Yeah, all the speakers spoke very well and brilliantly, and they have did perfect justice to the topics and all. I just want to say that after the completion of PG and how to proceed in future. You have to have a clear goal in your mind where you want to go, like if you are going to have an institution or into the private practice. If you are going to the private practice, go to some training part kind of things in corporate or some medical institutions and start learning the skills and all to have a confidence. And then you come to the private practice. In between, you can save some money. Financial issues are always there. And when you start your practice, then save money and invest and go solo. And later on, you go like developing an institution like everybody does. Then initially, everybody goes solo. Then they include the people, expertise, improve the expertise, and then gain with a big name and all. So you have to have a clear goal. So very good, Dr. Nishant, and all this.
Thank you all.